Hello, my name is Arnold. I'm going to be your practitioner.
Hello.
We're going to evaluate your heart. So right now we just took his blood pressure. He was sitting down for 5 minutes. We did the blood pressure while he was supine and sitting upright. So now, for the purpose of this video, we're going to use this chair. We're going to position our patient at a 45-degree angle so we could evaluate his jugular venous pulsation. And we're going to look for pulsations. If you could please take a turn to that side. So we're looking for pulsation because we're going to measure the jugular venous pressure, and we do that by obtaining a ruler and a straight object. In this case, 2 rulers we do, and we're going to put it under the sternal notch at a 90-degree angle, and then we're gonna measure to get the jugular venous pressure. But first, before we do that, we have to make sure if we see any pulsations. So we do see a pulsation here. Just if for any reason you don't see any pulsations, or you see too high a pulsation, you could adjust the height. If you see less pulsations, you go a little down. If there's too much pulsation all the way up, you go a little higher. In this case, we're okay in a good angle, 45-degree angle. We're going to use this, put it at a 90-degree angle, and we're going to measure his pulsations using centimeters, and just about 2 centimeters. So that's considered normal. Less than 3 would be considered normal jugular venous pressure. Now we're going to inspect for pulsation. Same thing on this side. Okay. Now we're going to feel the carotid pulse. If you could please turn this way. We're feeling for the rate, rhythm, and intensity, and if we feel any thrills, and we're going to do the same for the other side. And we do it one side at a time because we don't want to prevent the patient from fainting if you do them both at the same time. Now we're going to use the stethoscope to listen for any bruits on the carotid. So we're going to do that. So sometimes it's helpful if you ask the patient if they could hold their breath for a few seconds. That way you don't confuse the tracheal sounds when they breathe. If you please hold your breath. Okay, good. On the other side. Okay, good. So no bruits were noted. So now for the purposes of this video, we're going to leave the shirt on, but this should be done without the shirt. Now we're going to inspect the chest wall, and then we're going to auscultate the cardiac areas. But first we're going to begin with inspection. We're going to inspect the sternal borders to see any abnormalities, to see anything. We're gonna palpate using the pads of our 3 middle fingers, and what we're trying to feel on the areas that I'll explain right now is if we feel any lifts, thrills, and heaves. And we're also going to go to point of maximal impulse, which I'll explain right now, and feel the pulsation. So first we're going to start off at the aortic area, which is located on the right intercostal, right sternal border. Then the pulmonic, it's the left intercostal, left sternal border. The herbs is one below, a third intercostal, left sternal border. And the tricuspid valve area is in the fourth intercostal, left sternal border. And then we're going to go to the mitral, or also known as the point of maximal impulse. It's going to be in this area. It's going to be in the left midclavicular, fifth intercostal. And if we have any issues or we want to get a better feel on the point of maximal impulse, we could ask the patient to scoot over on his left side, and we have a better feel on the point of maximal impulse, and we could feel it here. So we already inspected and evaluated for any lifts, thrills, or heaves. Now we're going to auscultate. So when we auscultate, we're going to use the diaphragm and the bell. So we're going to first use the diaphragm, and this is used for high pitched sounds, and we're going to auscultate the same areas, and I'll go over them again, but we're listening for the normal S1, S2, any S3, any abnormality, heart sounds like S3, S4, any murmurs or clicks that might be here. Or we're also looking for physiological S2 splitting, which can be caused or sometimes normal in younger kids or younger adults, and it's basically caused by a lag of the valves closure when upon inspiration. S1 is a closure of the mitral and tricuspid valves, and S2 is the sound of the closure of the pulmonic and aortic valves. So we're going to begin first with a diaphragm, and once again, this is done without the shirt, but the purpose of this video, we're going to keep the shirt on. So we're going to start off by the aortic, which is the right second intercostal and the right sternal border. Pulmonic, second intercostal, left sternal border. Herbs, third intercostal, left sternal border. Okay. Tricuspid is the left intercostal, left side, fourth intercostal, left sternal border, and then the last one is mitral, fifth intercostal mid-clavicular line on the left side. Okay, so if you were wanting to hear the physiological splitting, we ask the patient to take a deep breath, hold it, and then we listen to see if there's every time he takes a deep breath, if there's any splitting. So we're gonna go ahead and use the bell now. This is for low intensity sounds. We're going to use the same regions. The aortic is the right second intercostal, right sternal border. Left sternal border, second intercostal is the pulmonic. Herbs is left third intercostal sternal border. Tricuspid, fourth intercostal, left sternal border. Mitral, fifth intercostal, mid-clavicular line on the left side. Okay, so we're going to basically do the same thing to listen while asking him to take deep breaths to see if there's any splitting. So we're just going to use the same areas that I've explained. Just to take a deep breath, please. One more. Okay, so no splitting was heard. So this concludes the assessment. Thank you.